Hi, everybody. I'm just starting the recording. Okay. Hello, everybody. Thank you so much to Tilde for introducing the Spanish English interpretation. I'm also noticing that we have an American Sign Language interpreter here. Thank you so much for being here. That is wonderful. We haven't had ASL interpretation here before, and I'm not sure if someone on the call invited you. So thank you for being here. Really appreciate it. And if you're wanting to follow along with the interpreter, they are listed under their name as ASL interpreter Ben. So thank you, Ben. And thanks to the member who brought Ben here to this space today. It's really exciting to have interpretation into ASL as well as Spanish and English. So we are recording. I am recording. I'm just checking on all of these things that they're recording properly. Um, Ashanti, did you want to mention something?
Yes, hello. Hey, I just want to let you know that it was me, Ashanti, that brought in the sign language interpreter. I'm using an app, the Convo app, and it's connected to Zoom. And so that's how I was able to get a sign language interpreter. Sorry if that confused anyone, but yes, that was me. I brought in the interpreter. I didn't ask for an interpreter like ahead of time, but since it's on Zoom, I can bring in the one from Convo. So just thought I would say hi.
Cool. Well, thank you so much, Ashanti, for bringing along Ben. Really appreciate it and really happy you're here. I think I also saw somewhere in the comments a question about if there would be a transcription available, and I do believe that the meeting is being transcribed. Um, so yeah, great. And you can turn on the transcript like as subtitles, as captions if you click on those three dots more menu at the bottom of your Zoom window. All right. This is an amazing group of people who have come out to this webinar today. I'm really excited to see all of you. My name is Maddie Tatarka. I am the Worker Benefits Program Manager at the USFWC. So you probably have heard from me before at a webinar or a member meeting or in an email or several. Um, I'm really happy to be here doing my sixth open enrollment with the Federation, and really excited to introduce some new folks into our program who are helping us get some really exciting new benefits to offer to you all for 2026. I'd love to first introduce Robin Fox and Michelle Swain from Marsh McLennan. They are our broker partners now for the program, and they've been helping set up a lot of new and exciting things for us to be able to offer. That's really the culmination of the work of years now. So super exciting. And Robin, do you want to introduce yourself?
Yes, I am Robin Fox. I am actually an MSW by trade, and I have been working in the benefits area for probably 18 years. I'm emotional at this moment because Maddie and I and Michelle have been talking for, it feels like almost a couple of years, developing this behind the scenes. And we've been really excited about this and the fact that this is actually happening. We are overjoyed. And I really did feel tears in my eyes as Maddie was talking because we've worked really hard to get to this point to be able to offer exciting new benefits to all of you and all of your team members and all the people that are so dedicated in all the different mission spaces and areas that you give your time for yourself and your family. So I just want to say thank you, Maddie, and for the Federation for allowing me to be on this journey with you and excited about 2026.
Awesome. Thanks, Robin. And Michelle, I'd love it if you are available to introduce yourself too.
Sure, I'd be happy to. And I would like to just say hello to everybody this afternoon. Thank you for joining our meeting. I have to echo a lot of what Robin said. Although Robin and Maddie have probably been, I came in about this time last year. So they have been working on this much longer than I have, but it really has been a pleasure to work through this program of benefits and be able to come to all of you and offer this to you. We're very proud. And I have to say, Maddie and her team have put in so much work. So thank you to Maddie. We got to give you credit where credit is due. And I've been working in the benefits field for probably longer than I want to say, but Robin and I have been at the same place in the same office for about 13 years. So if there's anything that we can do to help you when you're reviewing these benefits, please let us know. That's why we're here. Thank you.
Great. Thanks so much, Michelle. I've also got a couple of my colleagues at the Federation here. If anyone wants to come off mute quick and introduce yourself, that would be great too.
I'm gonna switch to Spanish, so if you're an English speaker, make sure you are on the English channel and the interpretation channel. Voy a cambiar a español. Buenas tardes, soy Kate, soy la gerente de
Good
membresía.
afternoon. My name is Kate, and the membership manager. I am the person that guides you through your membership process and provides support in your participation in the benefits beyond the worker benefits that we already have.
Buenas tardes todos.
Good afternoon. My name is Temina. I am the director of membership here at the US FWC. In my team, I have others too that work with the membership to connect with the membership and to offer services and programs. I am so glad that there are so many of you here, and I hope that you learned so much and that you can that you are there in your places of work, and we're here to help you with anything you need. Thank you so much. And Maddie, back to you.
Awesome. Thank you. And as Kate put in the chat, shout out to the ASL interpreter for doing relay interpretation from Spanish to English to ASL. Mo, I think you're here too, if you want to just say hi.
Hi, everybody. My name is Mo Mankling. I will be speaking in English. I'm the Senior Director of Government Relations at the U.S. Federation of Worker Co-ops, and I just feel so proud about how this program has developed over the past, what is it now, 8 years, that we've been offering benefits at all at the Federation, under like Maddie's like just amazing like guidance and leadership. And I'm so excited to I tuned in because I really wanted to see Robin and Michelle, who I haven't had the opportunity to meet with yet. Just to see how this is developing, and to hear what you all are thinking. And it's very powerful to me to see, especially how powerful it felt to you, Rob. So yeah, thanks everybody. I'm so excited to even just be here listening. Check.
Thanks, Mo. And Mo was the original staff of this program and was the key in getting it off the ground, along with some other staff and important folks back in the day. So really great to be here. Thank you all for listening to our introduction. And now we're going to get sort of into the meat of our presentation. The other thing I did want to mention is I know that some places in this country are having some internet difficulties today. So if you find yourself getting disconnected in the middle of the call, feel free to either rejoin when you can or not, but you will, since you registered, you will get a recording of the full meeting, and the links that we share. So hopefully you can stick with us, but if the internet says no, it'll be okay. Yeah. So our worker benefits program, like Mo was saying, it's been around since 2017. We've served over 100 Federation members. And our program has always, from the beginning, existed to connect our members to health benefits, financial security benefits, so that we can create strong jobs in the worker co-op movement. And part of that is that we understand that doing the administration and figuring out these benefits can be really complicated. And so our program seeks to streamline some of that administration so that our members can just plug right in to a program that we designed for you, for our members. We at the Federation, we're a membership organization. You all are running the show of the Federation with your dues and your administrative fees and your participation in our governance and contributing as leaders in this movement. So we're really working for you all and to bring you the things that you're asking for and that you need. And so today we're talking about open enrollment for 2026, which goes through November 21st. That's going to be the deadline for when you have to, as an organization, say, we want X, Y, and Z benefits. And we're going to now go through all the different benefits and what that means. And also just to sort of speak to this moment, so this is a photo I've been showing in, I think, every webinar that I've done since I started working here. I just want to affirm that while we're talking about insurance, we're also acknowledging that healthcare is a human right. And right now in this country, that's not a right that we are being able to enjoy, including the right to the things that keep us healthy, like food. I know we're all facing down SNAP benefits stopping coming Saturday. I'm sure we're all thinking about either ourselves or close community members who are going to be struggling as a result of that. And yeah, our program is just one thing that we can do to sort of help each other navigate the system that we have while recognizing that what we really need is something different in the long term or even short term. So thank you for being here. We're talking about insurance because those are the benefits that we can offer through this program. And so I did just want to start off with a definition of what even is insurance. And so something that is just like a fundamental truth of any insurance policy that you have is that insurance is a business that's meant to generate a profit for the company that's selling you insurance. It's always going to be tied into preventing a financial loss for you as the person buying the insurance, whether you're talking about your health insurance or your car insurance. And so there's always going to be like a value that the insurance company ties to the thing it's insuring. So insurance is not going to be a guarantee that every cost you incur will be covered. It's not a social service, and it's not inherently interested in the well-being of the people that it covers. There are very rigid rules, and even when those of us who are working to support people using insurance really want to be able to solve everybody's problems with it. We don't have the secret answer to be able to fix everything through these means. So this is a tool that we have, and it's my job and Michelle and Robin's job and our team's job to help navigate it and utilize it as best we can. So the Federation's program, what we offer, we sort of have two buckets. I think of them as this like green box bucket and the blue box bucket, and they operate in sort of different ways. So they're the benefits that we administer and bill for, and that's what we're going to be focusing on today. So that's the dental and vision insurance that we've been offering for years. And then as of 2026, we're offering life insurance and accidental death and dismemberment insurance, which is also called AD&D. Um, I'll pause because I know that's a long word for translating. There's also short and long-term disability insurance, accident insurance, hospital indemnity insurance, and critical illness insurance. And we're going to go through what all of those mean. So if you're like, what on earth are these things? Don't worry, we're going to get there. Um, so those are all our like most hands-on programs where like whoever is at the worker co-op or the organization and is sort of the administrator there. They're going to be working directly with me to help you enroll, to help you with billing every month, and to make sure that people are able to access the benefits that you need. And if I can't answer your question, I turn to Michelle, I turn to Robin, and they help as best they can too. Um, then, in addition to the green box benefits, we are also able to refer our members to other places to set up medical insurance, retirement benefits, and HSA, HRA, FSA type benefits. I'm not going to go in depth with those today because we only have so much time, and I have some good like past webinar recordings on our YouTube page that you can check out with information about that. But those are going to be benefits that each of our organizations are setting up, sort of unique to your company to meet the needs of your workers, your budget, and what you're set up for. And so to talk a little bit more about how those like green box benefits work, um, basically what it is that everybody who's a member of the Federation who's enrolled in this plan is in one big insurance plan together. So the insurance company creates one massive invoice and sends it to me at the Federation each month with everybody's premiums, everybody's monthly costs for dental insurance, vision insurance, all the different types of insurance. And then we take those bills and we use our records of which workers are tied to which organizations, and we split those out into different invoices that go to each member directly. And so then the workplace sends that invoice, those funds back to us. They sit in our trust account until we've gathered the funds from everybody and we can pay them to the insurance company. Also, as part of that, we have our admin fees, which are just monthly fees that come to the Federation to help us pay for the labor of administering this program. So we're going to dive first into dental insurance, which is our biggest, longest benefit that we've been offering. And if you've used our dental benefit in the past, not too much is changing for 2026, except for the network of dentists. So in the past, we've been using Delta Dental this year since 2023. And this year, we're going to be moving all of our benefits to the Equitable Insurance Company. And they have a network that's actually pulling from a bunch of different networks around the country to basically create like one like big network that is basically designed to reach everybody around the country, more or less. And so we have materials that show all the lists of the network, but the easiest way to figure out which dentists are in network is actually just to go to their website, search where you live, and they'll list the dentists that are in network. There's also the same kind of coverage for out-of-network dentists as in-network dentists. Just typically, you as the patient would have to submit for the claim to get reimbursed for your dental care if you're at an out-of-network dentist. The things that they pay for are going to be the same as they've been in the past, which means you'll get 100% coverage for twice annual cleanings, exams, x-rays, that preventative care that's really important for dental health and dental hygiene. For basic care, which is sort of like the next step up in like degree of dental work, it's covered at 80%. And then the next step up after that is 50% covered by the dental insurance. And that's all up to $1,500 per year. There's also a pediatric orthodontic benefit. There's not an adult orthodontic benefit. There is a lot more information about the dental insurance that's going to be available on our website. I think if you registered for this, you will have already gotten an email with a link that goes to all of the info sheets for all of these benefits from the Equitable Company that goes in depth about what's covered and what it costs. We're going to talk about that too, though. Vision insurance is also pretty much the same as it's been in the past, except that we'll only be offering the VSP Vision Network now. And so that means they have a wide network of independent optometrists and also some of these chains that we know well and are like familiar around the country. There's a $10 copay for an annual eye exam, and then also an annual allowance for buying new glasses frames with lenses or getting contacts. So yeah, pretty standard vision benefit. And just a reminder, when we're talking about vision insurance, we are literally talking about like the ability to see. Like medical care for your eyes is usually more wrapped up into your medical insurance. So if you have some sort of like visual, like eye disease, retina issue, something like that. Yeah. Now we're going to talk about the rates for dental and vision insurance. This looks like this because it's pulled right out of our like one-pager PDF sheets that you have access to, just so it looks familiar. And what we're looking at here for rates is that actually for 2026, our dental insurance is going to be cheaper than it was in 2025, which is really exciting. Everything's going down by like a couple dollars, or maybe like $1 a person, which is great, $1.50. And then vision is staying exactly the same. The premiums aren't changing a penny in either direction. Our administrative fees are going up a little bit like they do most years. And so the way that this works, if you haven't seen it before, you need a refresher, is that our administrative fees are based on which benefits you pick and how many people are enrolling. So if you're at a workplace with 4 people enrolling in dental insurance and you're not offering vision insurance, then your workplace would pay $33 a month in addition to paying for everybody's premiums for those 4 people. If you had 30 people enrolled in dental and vision, then you're looking here, 26 to 50 enrollees, 30 is right in the middle there. And going over here to dental and vision, that would be $100 a month for administrative fees. Yeah, so that's how that works. And before I dive into all the new benefits, which is going to be new for me to explain in this kind of depth and probably new for a lot of people to hear about, I'm wondering if there are any questions about the dental or vision coverage. We'll have more time at the end. I just want to offer a pause here. Okay. I'm going to dive on forward. And Robin and Michelle, if I'm missing anything critical, feel free to jump in or if I get anything wrong. All right. So we're going to start out with life insurance and accidental death and dismemberment insurance, which is a really quite a mouthful of words, but we'll talk about it as life and AD&D. That's sort of the commonly used acronym. And so life insurance or AD&D, they are what this is a benefit that you pay a small amount each month so that in the event that you, or if you're paying for it, your spouse, either dies or has a catastrophic injury, there's a payout in the amount of life insurance that you've been buying to your beneficiary. So a loved one that you decide to leave it to, um, or in the event of an injury, you would receive the benefit yourself. And so, yeah, I mean these benefits are usually billed as sort of like create financial security for your family in the event of tragedy, the event of something that no one wants to happen. But these kinds of benefits can be really important to help family members continue on. I'm seeing Meg's question in the chat. Is that the same as long-term disability? Which is a great question, and the answer is no. It's different from long-term disability, and we'll talk about it. We'll talk about long-term disability in a few minutes. Yeah, and so there's a lot of different ways that you can pay for life insurance. There is this really simple option that we're able to offer this year, which is basically a $20,000 life insurance benefit that the workplace would pay for. And if you wrap life insurance and accidental death and dismemberment together, that would be a flat cost of $2.30 per person per month. So if you're thinking, I want to add a benefit, but I don't really know how much my budget can handle for next year, or I want to start small, see if people are interested, this could be a really sort of like good on-ramp to start getting used to adding some of these benefits, seeing how people are interested in using them. And they're the kind of thing where this workplace option, you would have to pay for everybody to have access to them. Because if a workplace is paying, the benefits have to be distributed equitably. So it would be also a great opportunity for people in a workplace who maybe haven't thought about life insurance or don't have it yet to get at least some sort of life insurance benefit at a pretty reasonable cost. There are other ways that we can also be configuring it if you want to add, you as a workplace could like offer this simple option and then offer people the ability to add on to the benefit if they want more than that $20,000. They could choose an amount, whatever amount they wanted, from the from the options. I believe it's up to $150,000 of a benefit without a medical exam, and up to $500,000 with a medical exam. And they can also add benefits for their spouse. So it's an option for people who are looking for life insurance. Maybe you can get a better price through these benefits than they could through just calling up a life insurance company and asking for the benefits. I'm seeing Barbara's question. Would life insurance only be for the time that you're part of the cooperative? Asking because I'm going to retire in the next few years. Robin or Michelle, could you talk about the portability of the benefit? Oh,
So with the voluntary life insurance, ultimately there are portability options. And once you look at the detail in the Federation's portal, you'll be able to read about that. And there is depending on the age of retirement, how much the benefit is worth. And then for like the coverage that would you'd be offered through the co-op, the $20,000, ultimately that's while you're working for the co-op or being, that's really typically sometimes there is conversion options, but typically it's really just the voluntary extra life insurance that you take that has a nice portability option that you can read about the detail.
Great. Thanks, Robin. And so Robin also brought up a really good, a really important word when we're talking about these benefits, which is voluntary. And so when we're talking about voluntary benefits, what we're referring to are benefits that workers have the option of whether or not they're going to sign up for it, because ultimately the workers are going to be paying for it themselves. So it's basically like thinking about it as the worker can volunteer to take the benefit. That's how it sticks in my brain. Yeah, Barbara, I'm seeing your comment that you're getting a lot of audio interference. Um, I think that the recording will be clearer unless other people are having trouble hearing me. Can someone else confirm? Okay, I'm seeing Stephanie saying no issues. Okay, cool. Thank you all for confirming that I'm not just saying garbled words to you all. But Barbara, I hope you can get the recording well. Um, Great. I'm also seeing Steve's question of if it's term or whole life insurance. And Robin, can you speak to that?
Yes. These are term policies, so it's really like the flat amount you have. So that was a great question. I did want to mention if somebody were to die in an accident, ultimately the benefit amount doubles. And I did want to mention that because I think it's an important piece of life insurance with AD&D, I mean, not that we like talking about death, but it's a real thing to talk about. So these are term, so it's really like that flat amount would be provided to your beneficiary. And I did want to mention, like Maddie said, the $20,000 policy is wonderful as a benefit that's given to all of your team members. And then the voluntary life insurance is a wonderful benefit for people to individually decide if it's something that's important to them. It's especially nice during your working years when you might still have a mortgage or you might still have, children you're helping get through school or whatever it may be. And then sometimes as we get older, we reduce some of that additional life insurance as we feel we are kind of, in a different place in our life.
Great. Thanks, Robin. And I'm seeing another question that asks if there's a minimum from a co-op that would need to sign on for life insurance, like if I'm the only person who wants it. And I think if you're only offering the voluntary, then that would be, if only one person signed up, that would be okay. Is that correct, Robin?
I'm going to defer to Michelle, but I believe the answer is yes, that is
Okay,
something that we did get approved.
great.
Yeah,
I'm seeing Michelle nodding.
if the company is paying for the life insurance, then everyone in your office should be covered under that plan. So if it's a flat $20,000 benefit, you cover everybody. If you
Yeah.
do the voluntary benefit, that would be one person in your office could get that, one or two or 10 or however many were interested. And I don't know if you mentioned it, Maddie, but there is also a child life insurance policy too, up to $10,000. And that would cover whether you had one child or five children. One fee would cover all of the children. Hopefully, that's not anything anyone would ever need, but it's there just in the event that something were to happen.
Great. Thanks, Michelle. And that's wrapped into the adult benefit, correct? All right. I'm seeing Michelle's nod that that is correct. Um, Great. Thank you. These are really good questions. I'm gonna move ahead to the short and long-term disability. But we will have some more time. Oh, actually, I'm seeing this question in the chat from Angelica that I'm trying to think of. Can someone in the Spanish channel read it in Spanish so it gets translated into the English channel? Okay, wait, no, sorry. Kate wrote it in the chat. It says, I'm still not clear. Does the life insurance end when you leave the co-op? And so if I'm correct from my understanding with you, Robin, the if you have the workplace, if the workplace is paying for the insurance, then the insurance would end when you leave the co-op. But if you, the worker, are paying for the insurance, then when you leave, you will have an option of continuing it.
Portability. Yeah, the word is portability. And Michelle, I don't know if you want to confirm. I don't want to confuse anybody because sometimes a group policy has a conversion option. But Michelle, I thought I would let you look that up during the meeting to see if that is something that's included. Conversion means it's an opportunity to keep your group policy, but typically it's more expensive to keep a policy that's converted. But we are going to double check to see if it has that conversion option for the group policy.
There is a conversion option. And so that would mean that you could convert it to a whole life policy when you leave. If you were to take it with you, if you were to have the employer paid flat $20,000 benefit. A lot of times that's at a different rate. So that's not at the rate, the group rate that it would be if you had a voluntary plan and you selected your own amounts. So there are different rates for the conversion. And at the time when you would leave, you would get paperwork and they would be able to work through it and let you know how much that would cost to take it with you.
Great. Thanks, Michelle. And that cost for the for any scenario beyond that 20,000 benefit that the workplace might pay for, the rate is going to fluctuate based on how old you are and also how much of a benefit that you want. So that's why I don't have the like rate table like I did with the dental or vision up on the board because it would just be like 100 different numbers that you're looking at. But the flyers that we have available do have those charts where you can really track, like, okay, I am however many years old and I want $100,000 benefit. I can find my age, find 100,000 and see how much it would cost. And that would be per month. All right, we're going to move into the disability insurance. And so we'll start with short-term disability. And so short-term disability insurance is basically insuring your income for the situation when you can't work because of an injury, an illness, or giving birth. And so the reason why I focus on that that I'm emphasizing that it is insuring your income is that disability insurance is not meant to pay for your medical care or increased costs to living that come with having a disability. What it's really doing is making sure that while you can't work because of whatever you are experiencing, you can still have that paycheck and the amount of your paycheck. And so what it's going to do is cover up to 60% of your pre-tax wages because it's the logic is sort of like after tax, you're bringing home about 60% of that pre-tax wage or yeah. And so it's letting you have that amount of money while you're unable to work. And yeah. basically the disability insurance. People don't want you to be having more money when you are using the benefit than you would while you were working. That's like the insurance logic there. Um, and so with this, sort of similar to life insurance, the benefit amount is all going to be calculated based on how old you are, and how much your wages are. So if you are uh, older and making a lot more money, the disability insurance policy is going to be more than if you're very young and making very little money. Um, it is interesting though that it goes up. There's like a little bump in when it increases around the early 30s because presumably that's when people are having babies. And that's when people are using the disability insurance. So it actually does cost a little bit more. Um, there are two options with short-term disability insurance. You can either offer it as voluntary, so that's the worker is paying for it, or you can offer it as a workplace benefit where the workplace is paying for everybody to have the same amount of benefit. And that can be like same proportionally. Um, so a workplace can say, we're going to pay for everybody to have this benefit at 60% of their pre-tax wages. I'm seeing Jamie's question of does it have a 2 week delay before you get covered once you've had an accident or given birth? And so what Jamie's referring to is something called the elimination period or waiting period, which so this policy does have a period of time where you have to wait 2 weeks after the onset of the illness or the injury for the benefit to kick in. Okay, I'm seeing a question. Some co-ops distribute patronage on 1099 patronage forms. How would the short-term disability plan provide for the loss of that income versus W-2 income? That might be a question that we have to address after the fact and can speak to more specifically um, once we can look into it a little bit more, unless Robin, you have, or Michelle, you have patronage disability insurance information off the top of your heads.
We'll need to do that later after the meeting.
It's a really good question, especially for worker co-ops where we know that folks are definitely getting income off patronage. So yeah, we'll make a
Can I
note and try
say
to.
just high level about disability is that ultimately we cannot make more than 100% of our pre-disability income. So ultimately, if we are getting a paycheck for 60%, we can still earn dollars from a different avenue as long as we stay under 100% of our pre-disability, if that helps at all.
Yeah, I would imagine that different co-ops are going to go about making those kinds of calculations in different ways because I know that patronage just works really differently for a lot of different groups. So I think we can try to dive more into what a general
And
answer would for that would be, but then maybe talk
yeah,
about it one to one if you've got that as like a
yeah,
civic.
and I do agree. I'm going to say a lot of these are going to be sort of internal processes that that individual co-ops come up with. So I don't think there's going to be an answer that is the same across the board, but I do think those are internal conversations to come up with what's logical and kind of staying within the general guidelines.
Great. Thanks, Rowan. Um, and so I just wanted to show one example of how of someone's disability um, premium and benefit calculations. So we have Rhonda, you can say it's Rhonda the seahorse, is 32 and has pre-tax earnings of $1,000 a week. Using $1,000 because it's a nice round number. Um, And so based on her age and the tables that we have, which are available in our like info sheet portal that everyone is going to have access to, um, based on her age and the amount that she earns, her short-term disability benefit would be $24.66 a month. And so if she needed to use her disability insurance, she would receive $600 a week because that's 60% of that pre-tax $1,000. And she can get that for up to 6 months or until she can work again, whichever one comes first. This is just a really general example, but that's sort of the general narrative of how disability insurance can work. I'm going to jump into long-term disability insurance. And so long-term disability insurance works very similarly to short-term disability insurance, but it can start once those the short-term benefits run out and continue basically for as long as a person is unable to work. Um, or until I guess Social Security benefits would kick in. And so it can replace up to 60% of that income, just like short term would be. The monthly cost is based on age and income. And with this benefit, it's one of those voluntary benefits, which means it's only available in a situation to be paid for by the worker, not the workplace. And I'm seeing, wow, right on cue, because I was just about to punt this over to Michelle with this question of how do short and long-term disability plans offered interface with supplemental disability income, with income replacement and eligibility?
Yes, just depending on which of these we're talking about, but in general, the short-term, the long-term disability, well, and the short-term, they work in accordance, and they will. Okay, think of the word I'm thinking of, Robin. Um, they'll work along with your state benefit or whatever. The disability benefit from Equitable will reduce by the amount that you're receiving from whatever other source you're getting the income from. I'm sorry, I'm getting an update required on my computer, so that's what was taking my attention
It
away.
really goes back to that, there could be an offset depending on everybody's personal different situation over time.
Robin, I think your internet is being funky, so
Ultimately,
maybe if you go off camera,
yeah.
we could hear you better. All right. I know Robin's been having some internet difficulties for a lot of today, but I think what she was saying is that this is one of those situations where it might be somewhat person to person, depending on which benefits you have, where you are, um, and that usually the benefit would be like the short-term disability benefit that you got through the Federation would be reduced by the amount that you're getting like from the state or whatever entity is covering you.
Right. Equitable's policy will offset with whatever your other income is. So you're not going to get your state income and then the full equitable benefit. They're going to make sure that you're not getting more than your pre-disability earnings. Like we said, the benefit is intended obviously to help us get back to work and to just kind of, pay the gap, pay while we're unable to work. Now, obviously, if you're on long-term disability, sometimes that period of time is longer than others. So your equitable benefit will be offset by those other state benefits or any other kind of benefits that you have.
Yeah.
Hopefully that
Usually,
helps.
yeah. I think that's clarifying. I think something that's been always a big takeaway from me is that there are usually a lot of mechanisms in place to keep you from using two types of benefits for the same thing at one time. Um, so I'm seeing Meg's question and Amethyst's follow up of that whatever state or personal disability doesn't cover, will this cover it? And I think it would be fair to say that it will cover it up to that 60% of your pre-tax earnings, but not beyond that. See, Eden logging off. Thanks, Eden, for coming. Another good question from Meg, what happens to long-term disability benefits if you're no longer working for the co-op or the employer? How does it work to have them long-term if you're not still employed?
So with long-term disability, you qualify based on the date of disability. So if you were disabled while you were an employee of the Federation, then that is the date that determines your benefit. And then you'll see in the materials that depending on your age at the time of disability, there are a lot of variables that come into play, which even underwriters and claims people at any insurance company will not answer what if, because there are so many variables. But in general, it's based on the age you are when you're disabled and then how long the benefit will run. There's a table in the materials that you can take a look at that and see how that benefit would run. But just because you're no longer employed, I mean, if you're disabled and you can't go back to work, that benefit is going to be a lifesaver for you because it's going to continue to pay you for a period of time till maybe your Social Security normal retirement age. Again, and there are a lot of variables, so I'm not saying you will be paid. I can't say that, but the claims people will work with you and your doctor and help determine um, if you still qualify for a benefit once you are no longer working. Robin, you look like you have something also to add.
I wanted to add another comment that might help us understand is once we're what they call on claims, so we aren't working anymore, but we've already the claims approved and we're going through that process. Ultimately, the insurance company has to continue working with you and paying for you, even though you might not be working anymore, and the company is no longer paying for the benefit. Once you're what they call on claim, the insurance company needs to continue working with you. And then, as Michelle said, there's a lot of different individual circumstances that are reviewed, but they work very closely with you all throughout that process and during that time.
Great. Thanks, Robin. Um, I've got a continuation of Rhonda's story. Um, so just to show how this would work. So let's say Rhonda gets sick and can't work for several years while she gets treatment. She had her short-term disability, so once that ends, her long-term disability insurance will continue to pay for 60% of her income. And so based on her age and her wages, it costs Rhonda $6.75 a month to have that disability insurance for long term. Another thing that I wanted to make sure I mentioned is that there are exclusions on being able to use these benefits for pre-existing conditions. So if you had a diagnosis prior to buying the disability insurance, you would not be able to just like immediately use it. Um, Michelle or Robin, can you talk a little bit more about that?
I didn't know if Michelle was going to take it. Go ahead, Michelle, let you take it.
Oh, yeah, I was going to say, so let's give the example that I'm pregnant, but I'm not nobody wants that at this point. But let's just give the example that I'm pregnant. I sign up for this insurance. I would not, I haven't had the baby yet, but I do have the baby going, after I am insured. But I had a pre-existing condition. I was already pregnant when I bought the insurance. Uh, if you if you have, oh, Robin, I'm losing my train of thought. My thought that I wanted to say was, even though I'm not covered for pregnancy, if I fell and broke my ankle, which did happen to me at one point, I did earn a short-term disability benefit for a different condition. So while you could have a condition that you are currently being treated for, um, that one may not be covered, but any other condition could be covered. So keep that in mind. And I think that, Robin, you're going to talk about the pre-existing condition limitation.
So ultimately, the best way to think about this, I'll use an example, is back issues. Back issues are pretty common, and many times throughout the years, you might have been treated for issues that can result from even exercise or all different things in life. And it's a chronic condition that people can live with their whole life, going up and down with back issues. So ultimately, I really want to enroll in long-term disability. And similar to what Michelle said, is that ultimately it's going to cover me for everything outside of what I've been seen for prior to taking the coverage. I think it's like if you've seen someone in the last 3 months, there's a couple different ways they word it, but after you've been on the plan for 12 consecutive months, it's now going to cover your back. So it's like you just have to wait out that period of time. So as Michelle said, it's going to cover other things that you've not been treated for, things that could happen. And ultimately, the item that is already being treated for before you take the insurance, after you've been on it for a year, ultimately now, if something were to happen, then that will be covered.
So you have to be on the plan for a full year before a previous condition would be considered covered.
And I don't want to go backwards, but I'm going to go backwards for 1 minute. So for short-term disability, if one of the co-ops decides I want to pay for short-term disability for my workers, and it's an employer-paid benefit, there's no pre-existing condition for short-term. For short-term disability that you get to elect individually, like maybe only a few of you want it, and you choose and you're paying for it, then there is a pre-existing condition. Long-term disability, whether it's paid for by your co-op or whether it's paid for by you, there's always a pre-existing condition. So I just wanted to kind of put those in those categories.
Okay. Thank you. I'm gonna move us along so that we can get to everything else. But I'm happy to answer more questions about this over email, or on the phone, and to pass questions along to Robin and Michelle if we can't figure them out together. Because I know these are really important things to have an understanding of. Okay, so the next three benefits all work in a similar way. We have accident insurance, hospital indemnity insurance, and critical illness insurance. And so these are three different types of benefits, or they're three different distinct benefits that all work in a similar way, which is that you pay either one flat cost or a cost that is just based on age. And basically, what you're saying is that you're paying so that if a specific thing happens, the insurance company will pay you a specific amount of money. So, with accident insurance, what it's covering is out-of-pocket costs related to accidental injury. And so when you look at the flyer, there's this big, long chart of all the different things that can happen to you and the amount of money that the accident insurance company will pay you if those things happen for you. And what it's designed to do is help you cover out-of-pocket costs like hospital copays or transportation or um, lodging for family who come to help take care for you, take care of you. Um, and yeah, it's a flat cost. You can add children, you can add partners. Um, and I'm going to go through an example of what this could look like. Robin, I saw you come off mute, and I'm wondering if you have something to add.
I was just going to say the easiest way to think about this is it's cash benefits. These are benefits to help with you, depending on what happens, with out-of-pocket costs. Out-of-pocket costs that are way over and above, like your medical, it could be childcare, it could be anything related to time away from work. So truly, these are benefits just to support you and family members. So for accident coverage, you think of children that are playing sports, they're easily injured. You know, you are a runner and you easily can trip on that curb. Anything that happens, it's really just a cash benefit based on what you go through. And these are,
Yeah.
I want to make it messy, but these are three benefits that have been mentioned by Maddie are portable benefits, meaning that if you were to leave the co-op, you do have like a 30-day window to contact Equitable and ask to keep the benefit and pay for that on your own.
Yeah, that's great, Robin. And so, just an example, like Robin was pointing out. So we have Frank, and Frank pays just for himself to have accident insurance. It costs $8.09 a month. And so this is just taking us through a scenario where Frank has a bike accident. He gets taken to the hospital in an ambulance, gets x-rays. Turns out he broke his arm and two ribs and gets a prescription for physical therapy and goes home. So, looking at the charts of what the accident insurance company pays out for the ambulance, the ER, the physical therapy, the x ray, the broken arm, and the broken ribs, these are all the cash benefits that the insurance company ties to these things. And together, that means Frank would get $1,650 to help with all the out of pocket costs related to this accident. Um, this is just an example, but this is sort of a narrative of what Robin was just describing and what that could look like. Um, then hospital indemnity. Okay. Oh, wait. Wow. Meg, what a good question. I'm seeing Meg's question in the chat. It's asking if accident insurance is for if there is not primary medical insurance. And so, what's really important to know is that this is not a substitute for medical insurance. If you've ever been to the emergency room and seen the bill at the end of it, even for something like a broken arm or broken ribs, um, you know that the bill at the end is going to be a lot more than $1,650. So this is definitely not recommended instead of medical insurance. This can help you pay for your copays for sure. It can help pay for um, getting to and from your physical therapy. It can help with buying takeout so you don't have to cook dinner after you get home from the ER with your broken ribs in your arm. Um, and so I'm seeing Ari's question of how does it interact with copays or deductibles with medical insurance. And with that, it's completely separate. So, like Robin was saying, this is a cash benefit. So your equitable accident insurance and your, I don't know, your Blue Cross Blue Shield health insurance, they don't talk to each other at all. Um, you get your cash from Equitable and you can turn it around and pay hospital bills. You can turn it around and put it in your emergency fund. You can pay your rent, like do whatever. Your medical insurance company doesn't care one way or the other. Um, Robin's also noting that you can get $50 from the accident insurance just by going and getting like a preventative
Flu
care
shot.
exam, any kind of thing. Yeah. Um, so yeah, if you go get your flu shot, you can get $50 from the accident insurance company, which like would honestly pay for a good chunk of a year of premiums in general. Okay, hospital indemnity insurance is really similar to accident insurance in that it is a cash benefit. Um, they pay in relation to how long you're in the hospital and what level of care you're in. So if you're on just like a regular like medical surgical unit in the hospital, that's a different benefit than if you are in the ICU, the intensive care unit. And so with this, it's another voluntary benefit where the worker would elect to pay for it. Um, and there's a high benefit and a low benefit that you can opt into. So there's the low benefit, which is $12.03 a month, or the high benefit, which is $22.01 per month for one person. Um, and so if Maria has to spend 3 days in the hospital because of appendicitis, um, if she gets the high benefit, that's going to be $1,400 she gets from the hospital indemnity policy. And if she has the low benefit, that's $700. So that's just a choice you can make about like the cost benefit to you. Um, maybe you know that the low benefit would cover your like hospital copays exactly. So you choose to do that. Um, or maybe you know that your medical insurance has really bad hospital coverage, so you decide to go for the high benefit so that you can cover some of those out-of-pocket costs that the insurance won't pay for more easily. And this also has that $50 benefit that Robin was mentioning. So you go get your flu shot, you go get your annual exam, you let the company know, they'll send you $50. And finally, in this sort of trio of benefit offerings, there's critical illness insurance, which will cover out-of-pocket costs related to having a diagnosis of a critical illness, which is depending on how much you pay, how much you choose to pay. It's either a $10,000 benefit or a $20,000 benefit when you receive a diagnosis. Um, and this is a list of some of the diagnoses that are involved. It's not the whole list, um, but it's a lot of it. So, we're thinking about the like illnesses that are very difficult to navigate, and have a lot of impact on our lives, like cancer, cardiovascular conditions like heart attack, stroke, degenerative illnesses, um, a coma, onset of a new disability, like blindness, deafness, loss of speech, paralysis, organ failure, severe burns. And children are also included in their parents' policy. So if you have a child born with one of these pediatric conditions, you could also get a partial benefit to help with the astronomical out-of-pocket costs that come with being diagnosed with one of these illnesses. Um, and it's, yeah, I mean, having $10,000 or $20,000 to help pay for some of the costs that can occur from some of these things, like, I think we know that for some of these 10 or 20K might not scratch the surface of what you need. Um, for some, it might give you a really solid cushion to help out with you and your family and your care costs. So it's one option, can be one tool that you have. And this also has the $50 benefit that Robin was mentioning. So you could opt to get all three as a worker, and make sure you're going every year to get your do your wellness checkups or exams, get your flu shots, get your COVID vaccines, and get that $150 every year. Um, and yeah, any of these could come in handy because none of these are, by definition of insurance, none of these things are things you can predict happening. So yeah, those are the benefits that you can now choose from if you're part of our program, which is really exciting. Um, we have a new admin fee structure for how we are going to offer these benefits, and we're sort of doing like a special because it's our first year and we don't know exactly how it's gonna go, how much hands-on involvement people are gonna need or not need to manage having these benefits. So we're basically like putting them into three categories. We have family security, which is life insurance and accidental death and dismemberment insurance. We have wage protection, which is short and long-term disability. And then we have the out-of-pocket expense coverage, which are those last three that we covered. And so you can pick from those three which ones you're going to offer your workers, and with the ones where there's an option for the workplace to pay, if the workplace will pay. If you choose one category, the admin fee is here in this first column. So smallest groups pay $20 a month, then 30, 37, 45. But if you have two categories or three categories, it's the same admin cost. So this is sort of a like, thank you for leaping into this with us together. We know we're in really good hands with Robin and Michelle, and we'll see how it goes. Really, really, really will welcome your feedback on what's working, what isn't, what resources do you need, all of that. Um, the other super exciting thing is that being in any of these programs, including the dental or vision, means that all of your workers and their dependents will have access to an employee assistance program for free. This is confidential support for mental health issues, finding childcare, elder care, finding legal support, um, financial planning, support with managing identity theft, all kinds of things. This is like a big company that does this, so they have language support in lots of different languages. And yeah, we know that, I mean, the world is what it is. Everybody's having a really hard time. We're hoping that this can offer at least some support to folks in a way that can be pretty accessible. Yeah, so thanks to Robin and Michelle for also their work advocating for this. Yeah, I'm gonna, we're getting close down to the end of our time, and so I'm going to just like hurry a little bit through the end of the presentation with some important information. I think you might be wondering, like, wow, this is so much information. Where do we even start? I think the two most important things that you're going to have to assess for your organization, your co-op, is what's your budget and what's your capacity to manage all of these things together. Taking into account what is requiring an organizational contribution, what the admin fees are, and then making sure that you can keep track on your end of like the payroll deductions that are involved and making sure that the money can get from the worker to you, to me, so or to the federation so that it can get to the insurance company. And I'm happy to talk one-on-one with folks about sort of what the best course of action will be. Our timeline, really important. We are going to be asking people to fill out their participation agreements, which is sort of like the form and contract that you sign to participate in the program. That's going to have to happen before people can begin enrolling so that you can tell us what benefits we should be telling people at your workplace they have the options of. So that's going to be available. I'm either going to send them out on Friday or on Monday. You'll be able to sign it through a form, read it all, pick what you want. And once you've done that, which will be by November 21st, your workers will get access to the Employee Navigator system, which is this really robust online portal where people can select their benefits, put in their information, and then can refer back to that over the course of the year to make changes if they need to, or see like what benefits do I have again, and look all of that up. We're also going to have access to a call center from November 19th to December 7th, where workers can call a phone number to get walked through the whole enrollment process. That'll be in English or in Spanish, and those will be trained people who know what benefits are available, and can help people navigate Employee Navigator, and also um, make the choices that are going to work best for them. So that's really cool. We haven't done that before, and that's something that Robin and Michelle have advocated for. Um, and then, yeah, workers will have to finish their enrollment by December 7th. And then on January 1st, all the benefits begin. So that's the timeline. This is the Employer Navigator site. Like I said, it's a great online platform. We have a lot of resources available to help people use Employee Navigator. We have flyers, we have the call center, we have videos where I'm walking people through. Um, Carla Cooperator was my little sample person. Um, let's see, should I go through the FAQ? I'm not going to go through the FAQ because I see people have questions, and these will be distributed, these slides, with the recording. And they're also on our website. So just to reiterate that the next steps that you have are to review our benefits options and decide what you as an org want to offer. Contact me with any questions. We have the this is our info sheet library. You can click through with all of the benefits to see some like basic overviews, and then click on these flyers, which have like all of the information that we were talking about with lots of questions and the cost tables and all of that. And you can find that right here, but also from the Federation website. Just click there, it'll take you straight to that same library. And yeah, complete your participation agreement as soon as you can, but no later than the 21st of November. And then after that, you'll get all the instructions that you need to help people finish their enrollment by December 7th. Like I said, if you want to discuss more, email me. You can also, here's my Zeeg link in the chat, which is like an online scheduler, like Calendly or something. And yeah, it's 5:27. I want to respect that we've all been here for almost 90 minutes. And I will answer the two questions in the chat. And if anybody has other questions, I can stick around for a little bit. So yeah, I'm seeing Meg's question. EAP is available if we're enrolled in Equitable. Yes, that's correct. If you're enrolled in dental, vision, life insurance, disability insurance, accident insurance, hospital indemnity, or critical illness, then you will have the EAP available to you. And I'm also seeing Sarah's question, which says, my co-op does not have payroll. We pay our members by guaranteed payments. Do we still qualify? And so, Sarah, the answer is that if you have workers earning payments that are being reported on K1s, like K1 tax forms, then that is okay. But what we can't accommodate are 1099 contractors. Okay. Yeah, I think I'm gonna leave it at that. Thank you all so much for being here. And if people have questions, I can stick around, but I am gonna close the presentation so that folks can get on to the next part of their day because I want to respect everyone's time.
Thank you, Maddie.
Thank you, thank you. Thank you, Robin and Michelle, for being here. Thanks to our interpreters. Um, Thanks to Ashanti also for bringing interpreters. Thanks for Kate and Tamina and Mo for being here.
All
Really
good from
appreciate all the
Ashanti.
questions. Okay, I'm gonna stop the recording.